Dr. Hammond's going to speak to this a little bit more broadly. Predictably, the number of positive patients are rising in the county, but when you compare it to other counties in the state, we're relatively under control, again, compared to those other counties. So that speaks to some extent to the cooperation that we're seeing locally. In terms of McKenzie Health System, we process some patients who have come here with what they believe are symptoms. I can say that we've not had to admit anyone where we've been able to safely process them using some of the negative pressure rooms that we've put in place, and then either have them go home until they get the results, or if they have results, then they can self-isolate. And if it progresses to a point where they need to be admitted, we've been moving those patients to other facilities where they have a COVID unit and they can better manage those patients than we would be able to do locally and really want to do, because we want to keep that out of here if we can. We saw a lot of potential problems with obviously a highly contagious disease like COVID, and when we became aware of it back in March, we were pretty aggressive about putting a number of processes in place as well as policies, including starting an internal COVID team that did nothing but evaluate on a daily basis what was going on and how we can protect not only the staff in the organization, but also any patients that may be trying to access care here. So how we process those patients, we came up with procedures and policies very early on. And we've been doing that and refining it ever since. Part of that as well was activating our emergency operation center for situational awareness, which gives us access to resources like protective equipment from a regional standpoint, should we need that. If we got into a situation where we had an outbreak or we became a hotspot and we needed to deal with those patients locally. What I can tell you is that we have been able to screen everybody once we lock the place down, and we do that for patients as well as staff on a daily basis. So anybody entering the facility is screened. We check their temps, we record all that for documentation purposes, and when somebody doesn't pass the test, then they're sent home, and if they become symptomatic, we can collect a specimen on them, and we're fortunate in that we can run that specimen here locally. We were able to put on board in our organization not one, but 4 negative pressure rooms. And why that's important is because it allows us to isolate somebody outside the facility who's presenting. If they don't pass the screening questions, we think they may be positive, then we can put them in a negative pressure room. They don't cross-contaminate anyone else. And that, as simple as it sounds, is pretty unique, not only in a rural facility, let alone having 4 negative pressure rooms. So again, we're able to keep the rest of the organization safe and hopefully virus-free. In terms of how we're operating today, we're being consistent with whatever the executive orders are. So the one thing that got in our way a while ago was not doing any elective surgical procedures, and we've been able to overcome that, as have many hospitals, and we've opened that back up. The way in which we protect ourselves and the patients coming in, however, is we are able to do the nasal swab, which is called a PCR test, and we do that on every surgical patient pre-surgically, and we can run those results and get them back. So we're not letting someone into the organization, particularly into the OR for a surgical procedure, who may be unknowingly positive with COVID. I'm particularly proud of the COVID testing equipment that we've been able to secure. We were on the front end of that back in March when things started to break out. We just happened to have an instrument here that we were evaluating anyway, so we were able to fast track that, do all the stuff that lab needs to do to make sure that that instrument was performing at a very high level. And then we went ahead and made that investment. And what it allows us to do is do the testing right here. The limiting factor, unfortunately, are the supplies that we need in order to collect a specimen and then run the test. So we've been trying to be very prudent about the number of tests that we can do and make sure that we save those for emergency room patients as well as any staff or pre-surgical patients. I can tell you that we do have another instrument that we hope will be here by the end of August, running sometime in September, which will allow us to even do more of those tests, again, pending the availability of supplies that allow us to do that. The other testing that people hear about is antibody testing, and we've been able to do that as well. And we do it with a high level of sensitivity and specificity. It's actually at 100%. So you can count on the results that you're getting. And I think, you know, what I'm most proud of is that we've been able to bring that locally, and hopefully we'll be able to get enough supplies to where we can make that available for everyone who wants it. The last and maybe most important message is that if you're a patient who has problems, or you think you're ill, or just has chronic conditions, and you need to come in and visit and see your provider, or even come to the hospital, don't worry. This place is safe, and arguably probably one of the safest places in the community to come if you're not feeling well. So we are taking a number of precautions, and we're doing a great job keeping everybody safe. And then obviously play a role, you know, do the things that you need to do. Wear a mask, wash your hands, and try to physically distance yourself. That helps all of us, protects everyone. So thanks, Penny.
Thank you. Now we'll turn it over to Dr. Hammond.
Hey everybody, can you hear me okay?
Yes.
So there are definitely, so I'll just talk a little bit about the county level. So on the county, there's 105 cases confirmed of COVID in Sanilac County, 5 deaths. Now, looking at it as a thumb, so when we think of the county, we think of just Sanilac County. However, you have to remember that many of the people that live in the county work outside the county, and vice versa. Many people that work in the county are from outside the county as well. So as a total thumb, including Huron, Tuscola, Sanilac, Lapeer, part of St. Clair County, there's 1,650 people who have COVID in our areas. So that's quite a number when we look at it. 105 Sanilac County. However, the counties that contribute to our county, 1,650 patients, including 115 deaths total of all the counties combined, which is quite significant. We're seeing, as compared to March, April, May, we're seeing kind of a steady increase in numbers in the counties. I say plural counties. Sanilac County, we had a little uptick for the past couple weeks of July. However, August, we seem to be leveling off. We're seeing a lot more mask usage, which is great, because as Steve mentioned, there is no cure or treatment currently. There's no vaccine. We just know how to prevent it. Mask usage is paramount. You have to wear a mask if you can't social distance. The hand sanitizing takes the place of hand washing. So hand washing is preferred. 20 seconds of soap and water, warm water preferably. If you don't have that, hand sanitizer, rubbing your hands completely till they dry, that's considered equivalent to hand washing. And then social distancing at least 6 feet. Some say a little bit more than 6 feet. The outdoor environment has more airflow, so that's considered a better environment than indoor. The warmer weather has been shown to be more favorable than colder weather as well, so we're in a good time of the year right now. And we just have to take this seriously, and I think we'll be okay. There is some progress towards vaccines. There's currently 3 companies developing vaccines that are in phase 3 trials that should be ready to determine effectiveness and safety by the end of the year, with early production probably end of the year or early next year, with probably distribution to high-risk individuals, high-risk professions by the end of the year or early next year. This time next year, it should be a much different environment. We should be, many of us will have had a vaccine, and I encourage you guys, if you're not vaccine people, start getting vaccines. This is the time of your life you want to get a vaccine. You know, I'm worried about the flu season coming up, when we'll be having patients that have the flu, colds, and COVID. They all look the same. They all present the same way. So it's going to be important to help prevent the flu. And then by wearing a mask, you could help minimize transmission of COVID to yourself and others as well. McKenzie is doing a lot of very important things to prevent COVID transmission in the hospital. As Steve mentioned, we have our negative pressure rooms, which have been absolutely critical to minimizing the potential of spread of COVID from potentially sick patients with COVID to other people in the hospital and to staff members as well. Our testing at McKenzie is, not to brag, but probably the best in all the counties that I've seen. We do have the capability to do rapid testing for those needing immediate results. That's kind of limited currently. As Steve mentioned, we are looking at getting a rapid test that can do multiple testing at one time. I think we're going to be fine. For testing, we're doing okay at McKenzie. The other county hospitals are looking at their own forms of testing. Just, you know, the antibody testing, just to clarify, antibody testing, it's useful to tell if you've had COVID, but not if you currently have COVID. So just make you aware of that. McKenzie does offer both. So that's all I got. Thank you.
Thank you, Dr. Hammond. Now we're going to talk about going back to school with Duane Lange.
Thank you. Good afternoon. I'm Duane Lange, the ISD superintendent. Kind of give you an update where not only the ISD, but the 7 local districts are at in the county. All of us were required to develop back to school plans, which have been developed. Boards have approved them, they're local boards, and was submitted to the state yesterday. We got approval on those plans this morning, so they're in place. The plans also are to be posted, and that probably won't happen. Like our plan is up on the district's website if you ever want to look at it, Sanilac ISD website, and you'll see a back to school plan. You'll get an idea what it looks like. Every district's plan is going to be a little bit different based on their specifics and obviously the makeups of their buildings and the age of their students. But plans will be posted. They should be posted no later than the end of next week on the districts, on the respective district's website. The plan consists of several areas. Right now we're in a phase 4. If we would go back to a phase 3, one-off face-to-face instruction will be eliminated and would all be done virtually or remotely. We're planning for phase 4 right now. Facial coverings will be required for students in 6th grade on up through 12th grade, unless that student cannot wear a mask. At the Career Center and in some of our programs specifically, if we have a medical reason why the student can't wear a mask, we are going to ask them to wear the face shield instead, so there's still some type of covering there. Obviously, signage will be at your front doors and any entrance to the facility. With social distancing will be encouraged wherever possible. Obviously, in some of the elementary classrooms, it's going to be limited what you can do with social distancing, but that's going to be emphasized. I know all the local districts are working to reduce the number of class exchanges. When there are exchanging classes to be limited, you know, some are looking at reducing recess times, staggering recess times, doing things of that nature. In the area of food service, I know at the ISD, we're looking to feed their students in our special needs programs that we have all day in the classrooms. They will not be going to a common area where they did before, once again, to try to reduce some of that contact time. Hygiene, obviously, all the districts have ramped up their cleaning in their districts. That has not only taken place through the summer, but that will continue. There's been a lot of purchase, I know, because we've shared some of the purchasing of masks, of your disinfectants, of your wipes, anything of that nature, of your hand sanitizer, which will be made throughout the school. In the area of transportation, I know at the ISD, and we're a little small, we're dealing with smaller numbers, we are attempting to 1 student per seat on buses. And there again, if a student can wear a mask, they will wear a mask. Our Maple Valley Elementary facility, due to the nature of the students' disabilities and the ages of the students, masks will be optional with those students. However, obviously all of our staff will be wearing masks. If we should move to a phase 5, really some of the only changes that will take place, most of the things that are in place will stay there. Facial coverings could become an option at that point. That would be a local district decision. Like I said, I'm speaking in very general terms for the local districts. If you are a parent and have some questions or concerns for the students in your district, I would highly encourage you to contact the superintendent's office in that district and or principal's office, and they can answer the specifics to the programs and where your child may be in. I do know all the locals are looking at offering a virtual option as well as the face-to-face option. I know that's one of the things that parents are struggling with, and meeting with students. I know we've received several phone calls. Really this week, it's really ramped up as far as the amount of phone calls that we've received for that. You know, a common question, can a student do virtual at the home school and still come to the Career Center? Yes, we are allowing that. We've had to make some modifications to our driving pass thing and stuff to allow that to happen. But I think we've fielded 12 or 13 phone calls specific to that. So there's a lot of different options out there right now for parents to consider. Our superintendents, we meet weekly via Zoom meeting. In fact, we have another meeting tomorrow. They've worked real closely, the local districts and the ISD, to have something in place as far as virtual learning opportunities for kids, for parents that may choose that option, or if we're moved back to a phase 3 where that will be a required option. I know a question that I've received is Sanilac County considering a delayed start to face-to-face learning? That has not been discussed at present time. I know that has gone pretty prevalent over the last few days. I think I checked online last night, and there were 74 districts throughout the state right now. Most of them are larger districts that have opted to back off the start of face-to-face instruction to a later date. Some went 2 or 3 weeks, some went out as far as November, some went out as far as December and January. In the 3 counties around us, Tuscola County, I know are starting the same time we are, the week of September 1st. Huron County have backed off till September 8th. They were actually originally going to start 3 weeks earlier or next week. And I believe Lapeer County start the week before us, the week of August like 25th, something like that. So that's kind of the general information I have. Obviously, I'll be happy to answer any questions that may come through the chat.
Okay, thank you. And anybody that has questions, you can type them at any point, and then we'll ask them at the end. And now we'll go to Dr. Gormley, talking about healthy kids.
Hi guys, as the local pediatrician, I got to talk on this topic. So the thing to remember about all of this is that kids can become infected with COVID-19. And more interestingly, and probably what I'm going to talk a little bit more about, is this multi-system inflammatory syndrome that has been kind of starting to pop up more since about the end of April. What's interesting about this is that we don't know a lot about it, and yet it can be pretty severe for some kids out there. We are seeing kids who have been exposed to COVID or potentially infected with COVID within a couple of weeks actually having this this problem pop up. So that's another thing that you need to be aware of, especially with everybody getting back into the school year. If your kid has been, with some ongoing cough, and more specifically fever, that seems to be the typical common thread, a persistent fever of about 3 to 5 days. And that's going to be anything 100.4 or higher in the pediatric population, so parents are aware. If these symptoms are ongoing, you're going to want to get a hold of one of your providers so that we can probably take a look at this kiddo and help you figure out what's going on. Again, while the numbers seem to be on the lower side, they are increasing. And I think right now the CDC is noting about 500 cases or so in the country, which is consistent with previous numbers that were suspected. And kids are unfortunately dying from this as well. So because of this, we want to make sure, again, that we're getting some information out about it. Things that parents can kind of do is already kind of talked about by Steve and Dr. Hammond. Make sure that you guys are keeping hands washed frequently, which again, I know can be difficult depending on the age group. We all got to try to do the best that we can here to make sure that things aren't spreading as quickly as they seem to be at this time. And again, at the end of this, I can take some more questions if needed.
Okay, thank you. And now we'll go to Brandy.
Hi, I was just going to talk to you about some healthy tips for hand washing and mask wearing in children. The thing with hand washing is I think if we look at it as more of a life skill and not just a COVID-19 skill, it'll benefit kids not just now, but in their future. So we should be encouraging hand washing pretty much at home, in school, in restaurant settings, or maybe in stores. So anytime that their hands become lightly soiled or they're touching things repetitively, so mainly before eating, after using a restroom, touching common surfaces. Dr. Hammond already mentioned that hand washing with soap and water is best for a minimum of 20 seconds. Sometimes that's not always feasible. And sometimes with our younger kids, it's even more of a challenge to try to actually get them to do it for the full 20 seconds and correctly. So don't aim for perfection, but just aim for continuing to improve on that skill each time they do it. Of course, right now, it seems like sometimes there's a shortage of stuff, but the types of products are numerous and options. So you can make hand sanitizer fun. You can make some at home with rubbing alcohol and aloe vera gel. You can buy it from, Bath and Body Works and get some with glitter in it for kids. I think little kids can learn how to responsibly use it and have their own, which sometimes is helpful because they can learn responsibility for their own hand hygiene. As far as mask wearing, it can be very frustrating. I mean, as a parent and as a healthcare provider to even discuss mask wearing, and sometimes it becomes a debate, which it shouldn't be a debate. With regardless of your personal opinion about masks, whether you think we should be wearing them or not, we need to realize that kids at some point, whether they're returning to school in-person instruction or if they're going to be doing it at home, they're probably going to have a situation where they're going to have to wear a mask. If they have to enter a hospital in an emergency situation, if they have to come to a healthcare provider's office, maybe if they're around someone else who's immune compromised, or even if they have to go into a store for any reason. So kind of the same thing, even if you're not preparing them for school, if you're going to prepare them just for life right now, there are times that we have to wear masks and where it's the best thing to do. As their parents, it's our job to determine what's negotiable and what's not negotiable. I'm never going to have an argument with a 2-year-old about whether or not they need to wear a seatbelt or be in a car seat. I'm not going to argue with my 4-year-old on whether or not they need their vaccines. I'm not going to argue with my 11-year-old on whether or not they need their vaccines. So as a parent, mask wearing, if it's necessary for something, should not be an argument with your child. It's okay to say this is non-negotiable. You have to wear a mask in these situations and in these settings. And at times they don't have to. If they can socially distance, if they're outdoors, if they're not around others, maybe they don't have to. But with school, they're going to have to if they're planning on any kind of in-person instruction. So it's okay, have a discussion and acknowledge their feelings, but you can insist that they have to wear them and be compliant with them. If you, as a parent, have not had a discussion with your child already about mask wearing, it needs to happen, and it probably should be happening now. You need to talk to them about why they have to wear them, as well as why other people have to wear them or should be wearing them. That maybe we're not going to prevent disease, but we might be slowing or reducing the transmission between, amongst people. Explain to them that just because they don't have symptoms doesn't mean that they might still have an illness. Just like other viruses, you can explain it maybe in something that they've seen before, like the stomach flu. If they've been around somebody who didn't seem sick, and then the next day they find out that kid's home with the stomach flu, and then they get sick 2 days later. If they've ever had an experience like that, they probably can relate to what it's like to be around someone not knowing they're ill and then become ill later. Recognize your own feelings and opinions as an adult. This is where it becomes, for some reason, a hot topic. But just because you might be annoyed by the mask wearing as an adult doesn't mean your child is. And I can honestly say that the last 3 weeks, we've been seeing more and more kids in the office getting ready to go back to school for physicals and their physicals and sports physicals, things like that. And the kids are not as bothered by the mask wearing, in my experience, as the adults are. So if you're upset and frustrated, that doesn't need to, project onto your child. But if they are and they're annoyed and frustrated, have conversations with them about why they are and why they may be necessary right now. And you can make it as fun as you can. They can find masks that are more comfortable. There are some that are thinner than others. I've also seen, people making their own. I'm not a sewer. There's lots of things online that you can, make masks at home that don't have to be sewn. You can purchase them if you want to. I've had a lot of people come in with different designs that they find are more comfortable. So it's just going to take some experimentation. The other thing with little kids is if you can start now with them and practice and help them to become independent, they're less likely to be, to fight you on it. So if they know how to put their mask on comfortably, take them off, maybe they have a spare in their backpack. Maybe they have them hooked around a lanyard around their neck so that if they do take it off, it's not, constantly, where's my mask? just like when they learn to tie their shoes, as soon as they learn to do it themselves, they're less frustrated with the process. So just keep practicing. There's no need to, punish or get angry or upset with them. Just keep reiterating and set a good example. If you have to go into the grocery store to get a few items, you take your child with you, put your mask on. Don't complain about it. Don't grumble about it. Do it. And if they're seeing you do it, they're likely to do it as well. Find a way to work it into your routine. So when they come home from school, maybe they throw their dirty mask into a basket so that it can be washed. Again, maybe they have an extra in their locker at school or in their backpack. So if they do lose one, they don't get upset about what to do in that situation. And I try to talk to even my kids about it. Remember that it's difficult for a lot of people. So try to teach your children and even yourselves to be kind to others. Hopefully, if someone's not wearing a mask, we give them the benefit of the doubt as to why they're not, and use it as a teaching moment that we can't always control.
Why is there such a difference in turnaround time on test results? Not only county to county, but within testing sites within the county.
I can start, Dr. Hammond, and then you can fill in what I don't cover. As I had indicated in the opening statement, we're one of the few hospitals that actually has the ability to do some of the testing that most people are familiar with, which is the nasal swab. And we know that as the state ramped up, they were overwhelmed with specimens coming in and unable to really keep pace with the volume that they were seeing initially. As time went on, they brought on a couple of private labs, and the one locally, or actually it's not local, but the one that the public health system is using right now is NextGen, which is a private lab over in Grand Rapids. And what we've seen is that they've been able to turn those tests around pretty quickly. We hope that at some point we'll have the supplies, again, the limiting factor, to be able to do all the testing that we need to do, and we'll be able to do that locally. So I just depends on what lab they're going to and how overwhelmed they are. Dr. Hammond?
Really nailed it. So that's kind of the hot topic item of discussion across the country really too, is delayed test results taking up to a week to 10 days for sometimes to get back. And it, really when it takes longer than just a handful of days, it's the test itself, it's the value of it comes into question, right? So Steve mentioned that different labs have different turnaround times. Again, at McKenzie, we have the capability to do that rapid testing for those patients who clinically are sick enough, or there's a certain criteria we follow internally to help determine who gets that test, because there are scarce resources at this time, limited supplies. However, the labs have become overwhelmed across the state, across the country too. So it's kind of hit or miss on sometimes there's gonna be a high demand for labs. One week it'll be higher than the other week. So my advice is when you go for your COVID test, wherever you go, ask the place you're getting tested at how long would it take for lab results to get back, or even call before you go in there, and maybe call a few different labs if you're curious too. So the average now we're seeing with the health department turnaround time is within 48 hours, 36 to 48 hours. But again, that can change any given time. If there's a nursing home or a few nursing homes that require tons of staff testing, employee testing, patient testing, it could increase demands and even maybe prolong the wait a little bit too. So definitely ask before you get tested. But in the meantime, be prepared. If you have symptoms, you're concerned you might have been exposed to COVID, while you're waiting for your test to come back, in my opinion, assume you have COVID until the test shows you don't have it. So, because the problem is when we talk about delayed results, those 7 days go by, and if you have COVID and you have a result back, you're walking around spreading out to others. That's 7 days of spreading around, that you could be being careful for. So, again, you get tested, you assume you have it until you get the test back saying you don't have it. I know it's a different thought process, it's a different kind of thing we're ever used to doing. But just until the tests get more better and more accurate and quicker, we kind of have to go with this philosophy.
So I've heard, if someone comes in through the ER, I've heard that McKenzie can do a turnaround test within an hour. Is that?
We can. I'll kind of jump on this. We can do that test, but again, we have limited supplies, testing supplies, so we reserve it for those who primarily are going to be sick enough to be admitted to the hospital. That's why at McKenzie, before any patients admitted to McKenzie Hospital or has surgery at McKenzie, we do a COVID test. And if the test positive and if they're sick and need to be in a hospital, we transfer them to the hospital and, you know, take care of COVID patients. Or if it's a surgical patient, we ask probably for a delay in the case or until you get things figured out, until you're no longer contagious. But then there are a subset of patients who want a COVID test who don't meet that level of sickness or priority that would probably have to take the test and have it a couple day turnaround time.
Okay. So another question is, if my child becomes symptomatic or test positive for COVID, how long do they need to be off from school? And do they need to have a negative test to come back? So Duane, maybe?
According to our plan, and we're going to, as we go through this process, we'll be working closely with the local health department. But I believe it's about if they test positive, it's going to be about a 14-day window and or a negative test.
Okay. Another question is, how safe is busing for students? What precautions are taking place? And is it one student per seat? And will there be open windows on the bus?
In the case of the ISD, because we're dealing with smaller number of students in our special needs programs, yes, it's our goal, and I think we've got a plan worked out pretty darn close that we're going to have one student per seat. Windows will be opened whenever possible with weather permitting. In the case of local districts, having been a local district superintendent, that's going to be almost impossible to go one person per seat. I know they're trying to do some things with family members in the same seats. I know they're looking at the open windows, you know, whenever the weather's permitting. But that's going to be local decisions on that. So I would encourage that person to contact their local school district, get the specifics.
Okay, thank you. Another question, how long after you have COVID-19 can you go out in public? I guess Dr. Hammond, that would be one for you.
Yep, 14 days is the kind of the recommended number. And just to emphasize on how do you know you're better after 14 days, we just assume 14 days is how long you'll probably have the virus and be contagious with it for. Now, as far as retesting goes, we no longer retest. The CDC recommended not retesting anymore. Why? Because it's been proven that those who are retested, some might be negative on the test, but there's quite a few who still might be positive on the test, on the retest, but not be contagious anymore. So rather than, you know, unnecessarily extend how long somebody has to be in quarantine for, they said 14 days, you have it, you're feeling better, no more fever. For 24 hours, no fever without you use a Tylenol or Motrin or anything that reduces fever. And your symptoms, if you have symptoms at all, if your cough is better, your runny nose is better, that's also a sign that you're probably recovered from COVID too. So 14 days is a golden number that you have to remember. And retesting is not necessary from a CDC standpoint.
Okay, thank you. Steve, a question came up. Are we good with the PPE? Do you have enough for the hospital?
We do. We've been fortunate. We've been able to get supplies. We're part of a large group purchasing organization that is able to get enough supplies and get them to us. So right now we're comfortable with what we have. And by activating the Emergency Operations Center here, that also gives us access to regional resources if we do find ourselves without PPE supplies that we might be able to get.
Okay, good. Another one for Duane. Will the local school districts be testing the students' temperatures daily before they enter the school?
No, not to my knowledge. None of us are, there's going to be communications if it hasn't already been sent home to parents, or we're asking parents to monitor that as long as the student doesn't have a fever of the 100.4, that they would be free to come to school. But we are not monitoring, at least at the ISD, the students' temperatures. Staff will be completing a self-assessment, an online self-assessment before they come in every day. And once again, I would check with your local, but to my knowledge, no one is doing the checking every student.
Okay. So if a child is homesick, is it required that he be tested for COVID-19 so he can return to school?
No, not unless there's in my opinion, not unless the symptoms occur where it could be COVID. We are not requiring that. That's going to be something we're going to be working with parents on an individual basis.
Okay, while I have you here, I'm going to give you one more. Is there a truancy level for the school districts? Has it changed based on potential days missed due to COVID symptoms?
Well, obviously, there's going to be a lot more flexibility, not only with students, but with staff contracts also. Truancy runs through the county. We have a shared program that we work with the courts. Brenda Cutler works for us 4 days a week as a truancy officer. And obviously, that they'll be taken into consideration if they're COVID type issues.
Okay, thank you.
Betty.
Dr. Gormley, in what age group do the MIS symptoms usually show up, the multi-inflammatory syndromes? Do you have a certain age group for that?
Yeah, so the MIS symptoms are actually a little bit older age group, typically around the age of 10 as your average age. So you're seeing that more in a 6 to about 12, 13-year-old block of age. For Kawasaki's disease, that's typically going to be younger. And I just wanted to comment real quick on that previous question as well. This is where we're really going to need the parents to help out with keeping kids home from school when they're sick, and making sure that they call the office to figure out what needs to be seen there versus just being able to monitor things at home. Thanks.
I think we already answered this. What temperature is considered a fever? And you said 100.4? Is 100.4?
Yes.
Okay.
Yeah, that's correct.
So parents need to be aware of that when they're checking temperatures. And then I have, can Mr. Lange talk about what the virtual option consists of and how long will the children be on the screen time?
That's all going to be dependent a lot on the age of the child. All the districts, they're not all using the same virtual platforms, because some of them were already using certain platforms, so they stayed with them. There's about 3 or 4 throughout the county, as depending as at the elementary or the secondary level. There's going to be a lot of variance on that, depending on what classes the student signs up for. Obviously, if it's a high school student, they're going to be more screen time. If they're taking AP online classes, it's going to be considerably more compared to an elementary student. I know the state superintendent, Dr. Rice, is working closely with a legislative group to waive some of the instructional hour time as far as fundings for schools. So hopefully once that takes place, it gives us a little more freedom. One thing that parents need to be aware of, though, it's going to look different than what the virtual training took place at the end of last year. Obviously, districts didn't have time to put it in place. It was kind of put on the fly, and there was not a grade attached to the work that students was doing. Now, if we end up back into a level 3 or the parents choose a virtual, obviously there's going to be a grade and requirements attached to that wasn't there before. So my fear is that some students, especially secondary students, what they saw last year at virtual learning, they may think that's the norm. That's not going to be. There's going to be considerably more work on their part and screen time on their part and accountability on their part to earn the credit and the grades.
And I understand a lot of the virtual will be coincide with the in-classroom teaching, so the kids are all at the same.
Yeah, that's the goal, because and different districts have different standards. Like some will give students like a 2-week window to try it, and if they don't like it, come on back in the one on the face-to-face. So there again, you're going to want to check with your local districts as far as what they're doing with the specifics. Now, a question was asked at the Career Center level. We are not going to put a virtual opportunity in unless we're closed down into a level 3, and it's just because of the nature of our instruction with the hands-on instruction. We have programs, we have things ready to go if we're required to go remotely, but we're not going to do that unless we are required to go remotely.
So if they attend the Career Center, they have to attend in person? As
of right now, yes.
Okay. And I have a question. Is virtual compared to in-seat, in your opinion? No. I think you get a whole lot more. It's in lieu of, but you're going to get a whole lot more if you have that teacher presence in front of you.
Virtual learning is very tough. There's a small group of students that really benefit and excel in that, but it's not for everybody. Someone, especially with some of the younger students, there needs to be adults sitting with that child, encouraging and supporting them along the way.
Yes. So here's another question. If my son gets exposed at the elementary, does my son at the high school also have to quarantine?
From my opinion, that's going to be a local district decision. But we would like, if I'm involved in that, I would like that communication from that parent. Hey, my child is tested positive. And I would say that, yes, there's going to definitely be a period of time where you're going to want to keep any of your children home until they either have a negative test or a period of days goes by without symptoms. I may want to refer that one to one of the medical people, but that's how I would handle that. Sure,
yeah, I'll kind of jump on that one. So if, say for instance, I was exposed to somebody who had COVID, I would want to watch myself for symptoms at home. And then in the same time, it's kind of hard to think about it, but in the same household, you want to try to be a little more careful around others and at home too. I know it's kind of a hard thing to do. Like, would you want to wear a mask in the house? If you have a runny nose and you're coughing a lot, you might want to until you get your test back saying you're not COVID positive. However, if you were exposed to somebody with a known positive case, now if you were exposed to somebody with a runny nose or a cough, and you come home, do you have to be super careful that you have COVID? Probably not. However, if you were informed that somebody you were exposed to as a close contact, we have certain requirements. What's a close contact? Had COVID, you definitely want to go home and watch yourself for fever, cough, symptoms, and then at the same time, be careful about who your others and what you do around other people. And I think this is kind of a good learning experience, as Brandy mentioned. It's kind of a life skill now, so we know now when we cough. My daughter told me this 2 years ago, you cough into your elbow. Now it's like, oh my God, you got to cough into your elbow. So things that we're learning now about hygiene and how to be safe around others, we just have to practice it more now, even at home too, when it calls for it.
We have a lot of questions about the quarantining. I think it gets a little confusing of, when you exactly quarantine, how long you quarantine. Anybody have any other opinions? What about if one of the questions is, what if you found out you were by somebody that did get, has a positive test for COVID? What would be your next steps that you would recommend?
So this is where wearing a mask is going to be so helpful, because when you're around somebody who had COVID and you're within 6 feet for a certain amount of time, they say within a 15-minute time frame, not consecutively either, so a total of 15 minutes over a whole day. The fact that you're wearing a mask puts your exposure level from high to low. And that can make a world of difference, if you get sick with COVID or if you don't get sick with COVID. So with that being said, wearing a mask is going to be helpful to determine, okay, I don't have a runny nose, I don't have a fever, it's been a couple days. And then to determine, if others around you should be very careful as well too. So the exposure period would be 14 days. So if you're in that close contact period to somebody with a known COVID case, and you were informed that you are that close contact, that within 14 days of being exposed, you could develop symptoms or even test positive for COVID. So that's why we say a COVID test, the next day after you were found out, will not be a good reliable indicator if you're going to get COVID or not. So in a perfect world, you'd be tested, at the end of 14 days to determine if you get COVID. And then if you get COVID, then the 14-day mark of when you're contagious starts on that day. So either from the day you have symptoms, or we call it 2 days before your test was done. So kind of whatever comes first. It's kind of confusing. It has to be put in writing to actually read it out and to make sense of it. But that will definitely be in place for the parents when they, have their kids back in school.
And I would say that it's why it's important to talk to your primary care physician. Go see Brandy, go see Dr. Gormley, so they can guide you on this information, correct?
Absolutely.
Yeah. So Brandy, back to hand washing. Is there a song or something you could recommend that the kids should sing while they're washing their hands?
Well,
Can
most
she
songs
sing
are
it too?
I'm not singing it. Most songs are about 3 minutes. So if they can sing a whole entire song, that's pretty good. But the birthday song or their ABCs is pretty close to 20 seconds.
And then I have a question as a medical professional. We're asked, as medical professionals, do you think face-to-face school is safe right now?
Personally, I think yes, as long as all the measures are in place that they're doing. I personally think our schools have the best interests in place, or best interests for our children for safety as well as their education. And I think they're doing everything they possibly can. So I have no reason to say that they're not any safer than anywhere else.
Yeah, I would agree with that too, especially since, as Duane was saying, they're putting a lot of measures in place. And right now, the statistics are showing pediatric population is, I think, accounting for about 2% of the positive cases. So again, it's just, not only is it a little lower likelihood, although it can happen, and the severity is less, we still just want to be able to minimize that. But from a safety standpoint, I don't have a problem with the kids going back.
Yeah, I think we have to be mindful that, what we know helps prevent transmission, the masks, the hand hygiene, the distancing works. When it comes to the amount of cases that we've seen as a country, we have to remember that for the most part, kids haven't been congregating since March. So we don't really know how sick they'll get and how many will get sick, and also the important question is how many of these that do get sick, how many of those will transmit to adults at home, teachers too. So that's why the whole hand hygiene and the mask is going to be absolutely vital to ensuring that, our kids don't get sick. And as Dr. Gormley told you, kids do get sick with that multi-system inflammatory disease, and also kids do get sick with COVID. So we don't hear about it, but kids do get sick with COVID. They are in the hospital for COVID. They are in the hospital for oxygen. Because kids are adults. I mean, kids have the body habitus like as adults. Kids are humans, and we all know that kids will spread strep throat around your whole house. They'll spread the cold, the flu around the house, and they will spread COVID around the house too. So we just have to keep that in mind, that kids will spread this. They'll get it, and I think the school district is absolutely going to do a great job at helping prevent the transmission as much as possible.
I wanted to enforce what Dr. Gormley said about keeping your kid home if they are sick. I feel like pre-COVID, we sometimes as parents, we get a little lax because it's not convenient to have a sick child. It never is. So we get a lot of phone calls with people wanting after school appointments, but they think their kid has strep throat and they sent them to school with the fever and gave them some Motrin. Especially now, that should not be occurring. And even as adults, we go to work when we're sick or we have a cold or, I had a stomach bug yesterday. If you are sick, stay home. That's the best thing you can do to reduce the transmission to others, and keep your kids home.
So 2 more questions and we'll finish up. If an entire classroom is exposed to a student with COVID, will the entire class be put into quarantine?
I can speak to the ISD specifically, like the Career Center situation. What our plan is at present time is the number 1, consult with the local health department and get advice on that. And if we're aware of a positive test, we'll be contacting everybody, all the parents and any staff that may not know already in that classroom to make them aware of it. And then we'll specifically be tracking where that student was, were they working close with 1 or 2 partners. Based on our programs, they may not, even though they're in the same classroom, they may not be in the same area due to our different lab locations. So that's what we will track. At Maple Valley Elementary, we will also be obviously notifying any of the parents in those classrooms. We'll make decisions from there. The concern with Maple Valley Elementary, many of our students are very medically fragile due to their disabilities. So we'll be working closely with parents. And once again, I want to reemphasize from the parent standpoint, if you have a student that's even, you think is remotely maybe sick, please keep them at home and seek some medical attention on that. As far as the local districts go, those are going to be local decisions, and they're going to need to contact their local district superintendent to find out how that will be handled locally.
Okay. This is a good question. My kids have not been outside of the home since March. How can I help their immunity before they head back to school? Maybe Dr. Gormley?
Well, I think the best thing is making sure that we're following through on all the precautions that we've already kind of talked about, Penny, and making sure that kids are staying safe. You want to make sure that you're up to speed on immunizations at this point. And again, monitoring for symptoms that could be related to COVID, or again, even worse, MIS, and making sure that you're staying in contact with the providers as well. That's going to be the best thing. Again, as Brandy mentioned, hand hygiene, as Dr. Hammond was mentioning, keeping those kids home when they're sick. We've got to be able to follow through on those things. And that's really what's going to be, I think, the most beneficial during this upcoming fall season.
Thank you. We have a couple more questions that have just popped up, if you guys don't mind for a minute. Once children return to school, is it safe for them to be around grandparents once they are exposed to a larger group? Still taking the precautions of hand washing and masks.
So yeah, sure. It's fine. So just as we would, if we were told that we were exposed to somebody with a known case of COVID, you definitely be careful. And honestly, I would wait those 14 days. If I was told that I was exposed to somebody with COVID and I'm in that 14-day quarantine period, I'm not going out of the house. I'm not being exposed to others. However, just like as we're doing right now, and as Brandy mentioned, as Dr. Gormley mentioned, too, the hand hygiene, the staying home when you're sick, the stuff that we learn to help minimize prevention of the cold and the flu to others, let's just do this for the grandparents too.
And then the last well, I have two more questions. What are the symptoms of multi-inflammatory syndrome?
I set a link over there to the CDC's website in symptoms about MISC, that syndrome. So it's a very good link for parents.
Okay.
And I guess we mentioned there's a few different things. The high fever that doesn't break, or the high fever over I think so many days. Running, so it could be a lot of different symptoms. What we're seeing a lot of with these kids is a lot of GI symptoms like nausea, vomiting, diarrhea. It could be joint pain. That website really gives some good specific symptoms and what to look out for. But any questions at all, call your primary care office and ask, and really get checked up with them first.
Yeah, and the hard thing too is that so many of these symptoms are just kind of vague symptoms that could be consistent with cold, flu, and a lot of other things. That's why, as Brandy was mentioning, it's going to be a little bit harder to tell some of those, and you do need to see that persistent fever for 3 to 5 days is the typical average. And again, it's going to be so important that you get in touch with somebody to let them know what's going on. Don't just kind of blow that off. We want to make sure that these kids are staying healthy.
It seems like with COVID and with the MIS, it mimics so many other illnesses. So they really need to see the doctor, correct? Yeah.
Yeah, and we think a lot of that's related to the inflammatory response within the body.
Okay. So we had someone ask about band camp starting next week, and I looked up an answer on that, and the state of Michigan is in phase 4. So all indoor music instruction is percussion based only, no wind instruments, according to our phase 4 here in Michigan. So as far as in-room class for band, there's no wind instruments. And then as far as the band camp and being outside, if they social distance and wash their hands, the students aren't allowed to share water. They have to bring their own water. And each school will do this a little different, but if they follow those guidelines, then band camp, you'll just have to ask your school on how they're doing it. But if they're doing the same thing that all this instruction school's doing, then they're following the guidelines. So I hope that answered the question. So I think we're done with our Q&A time today. And I want to thank our panelists for their time today, as well as each of you have joined us to learn about these important topics. This was a second in a series of 3 town hall events. And our next one is going to be September 16th at noon. So watch your email for invitations and watch your email for a recording of this webinar. So thank you for joining us. Have a good afternoon.